Hello, welcome to today's session. I'm Monica Frederick, Senior Vice President of Strategic Accounts for Freespira. Freespira is a 28-day digital therapeutic treatment for relief of panic attacks and PTSD symptoms. Joining me today is Mark Rakowski, President of Children's Community Health Plan, an HMO based in Wisconsin, serving over 150,000 members. Mark, tell us about Children's Community Health Plan members. You have both Medicaid and commercial plan members. What are the similarities and differences in serving these populations?
Monica, we've got quite a diversity amongst our population. Within our Medicaid plan, cover about 150,000 individuals. About 60% are kids, the vast majority between the ages of 0 and 10. But within that Medicaid population, we have over 20,000 childless adults. We've got parents, we've got pregnant women as well. The commonality among that Medicaid population, obviously, is they are all eligible based on income and tend to be low income, tend to have a lot of challenges with things like transportation, access to care. Oftentimes provider offices aren't accommodating of when families can get in for care. Within our marketplace population or our commercial population, we cover about 15,000 individuals. Over 90% are adults with a wide variety of income levels. Individuals are eligible for the marketplace at 100% of the poverty limit, but we have members well in excess of 400%, individuals who don't have insurance offered through their employer and are buying coverage for themselves and their families. The one other commonality amongst both populations is the prevalence and increasing prevalence of mental health. And we've seen it since the pandemic, but even prior to the pandemic, we recognize that amongst our adult population and our adolescent population, mental health challenges have been increasing.
What led CCHP to look for new treatment options for panic attacks and PTSD symptoms?
Children's Community Health Plan has been focused on a number of conditions over the course of our existence, predominantly medical conditions like diabetes, asthma. We've got programs for pregnant women. We've also got a program for members with depression. And we've kind of had those programs in place for a number of years. As Freespira approached us with this solution for members with panic disorders and PTSD, candidly, it was one of the first times we looked deeper into our data. And the data was telling. The prevalence of both of those conditions amongst our members, again, our adult members, our adolescent members, was startling. The number of members who've been diagnosed with those two conditions surprised us. And when we looked again a little deeper at the cost side and the utilization characteristics of those members, we recognized that it was a population and a cohort that needed to have alternative treatment, needed something different than we had been providing in the past. So the Freespira treatment obviously presented that to us, an alternative that we hadn't offered to our members. It allowed them to get treatment in the comfort of their own homes. We recognize that particularly after the COVID pandemic hit, access to behavioral health service was even more limited. While telehealth was available, telehealth isn't a solution necessarily that is effective for all conditions. And so we found Freespira and the alternatives that it offered, both for convenience, but also I think a recognition that many individuals are reluctant to get treatment in person for conditions like panic disorders, PTSD, not only because of the stigma of behavioral health and mental health, but also just the ability to leave the house and to seek treatment presents a challenge for a number of individuals.
Thanks for that context. When we work with behavioral health providers, we've heard them say that they appreciate the long-term sustainable results from a short 28-day treatment. One provider said that Freespira provides patients with, and I quote, the highest level of independent functioning as quickly as possible. So it seems other healthcare professionals would relate to much of what you've just mentioned. Just so people can better understand what Freespira treatment involves, I'll take a minute to describe it. What you see on your screen is part of the Freespira treatment. This is the hardware, and you can see in the foreground a cannula that samples the patient's breathing. This is attached to a sensor that measures breathing rate and exhaled carbon dioxide. This information is sent to that small tablet via Bluetooth so the patient can see in real time this data. And the job for the patient is pretty simple. What they are asked to do is breathe in sync with a rising and falling audio tone. This is really important for patients with panic attacks and PTSD symptoms because they tend to have irregular breathing patterns. They tend to be chronic hyperventilators, yawning, sighing. So what Freespira does is it is a tool to help them develop self-management skills to normalize their breathing. Now, the hardware you see is only part of the full Freespira treatment. This is a high level you'll see on this slide and how we work with health plans and what the complete Freespira treatment looks like. We first work with health plans as we do with Children's Community Health Plan, diving into their claims and identifying patients that would most benefit from the Freespira treatment. As Mark had said, it's surprising to many health plans to see the prevalence of panic and PTSD within their membership. We then work with Children's Community Health Plan to develop a co-branded marketing campaign to get the word out, because this is a really new treatment. And we get the word out to members as well as providers. And then once a patient raises their hand and says, I'd like to try this treatment, we schedule a telephonic clinical assessment to authorize treatment. At that point, the system, the hardware that I showed you, is then shipped to the patient's home, and an appointment with a Freespira care coach is scheduled. This is done through secure video. That Freespira care coach stays with that patient throughout the 28-day treatment. They have regular weekly check-in calls, as well as calls throughout if the patient needs additional help. What's really unique about Freespira is we upload each patient's session to our secure server. So the care coach can see right away if the patient has missed a treatment, and will reach out to that patient to really drive adherence for the treatment. After the 28 days, we arrange for pickup of the device, and then we provide to the patient an app, which is the Freespira Tone app. And this is an app you buy in the Apple Store. This is an app specific for the patients who have completed the Freespira treatment. Children's Community Health Plan members have been using Freespira for just over a year now. Why is the treatment a good fit for your patient populations?
Freespira is a good fit for our population for a number of reasons. First, the duration, the short duration, 28-day treatment, we find is a great alternative to what could be very long-term ongoing psychotherapy and counseling that individuals have been going through. So we can know after 28 days, has this been effective? We also recognize this is not medication-based. So some treatment of PTSD and panic disorder are pharmacologically based. This is not. And while it isn't, Freespira can be used in combination with other treatment. So I think this gives another vehicle for for individuals and for providers to utilize in the treatment of these conditions. As I mentioned earlier, when we looked at our population, we were, I think, disappointingly surprised at the large number of members who have specifically been diagnosed with PTSD and or panic disorder. Well over 5,000 of our members have had that diagnosis, and another 10,000 plus very likely have symptoms of PTSD and panic disorder based on their claim utilization and based on other diagnosis codes that have been utilized with their emergency room visits, with their primary care visits. So obviously a high prevalence within our population. We've had over 500 members at this point engaged in the treatment in that first year, and that number continues to increase. We fully expect by the end of this year, we will be approaching 1,500 members that have gone through the Freespira treatment.
So now that you have members undergoing treatment with Freespira, what results have your members and your organization experienced?
The results we've experienced with Freespira treatment are in several different areas. First, in clinical, we've seen a significant reduction in the symptoms of members who've undergone treatment. For members with panic disorder, we utilize the Panic Disorder Severity Scale, PDSS. Looking at these members, 68% of members who've undergone Freespira treatment have a 40% or more improvement in their PDSS score. For members with PTSD, we utilize the PCL-5 scale. 52% of members who were treated experienced a decrease of greater than 10 points in their PCL-5 measure. As we look at the cost savings that we've seen with the Freespira treatment, we're seeing a 3-to-1 return on investment. And that is, as we're looking at post-treatment utilization and related claim costs, emergency department utilization has decreased, other related costs have decreased. Those savings that we've seen from Freespira treatment exceed the underlying cost by at least 3 times. And that's just really the tip of the iceberg. As we have our members continue to be enrolled in our health plan over the long term, we will continue to see that reduction stick as we look at their costs 1 and 2 years post-treatment. The final area that we'd like to share is the adherence to the Freespira treatment. When we look at our adults with panic disorder who've gone through Freespira, over 70% of adults have adhered to the treatment over that 28-day course of the program. So in that short term, we've really seen members engaged in their treatment.
We're glad you've seen such good results in costs and clinical outcomes, but we know that Children's Community Health Plan really strives to make a difference in patients' everyday lives. So what have members told you about the treatment in terms of their quality of life?
What our members have shared with us has been really overwhelming. And I think this is one of the few things that we do as a health plan that we understand we are changing lives and we are changing them quite dramatically. I think, for a lot of us, we look at claim data and we look at utilization and they become numbers. And we recognize through the Freespira treatment that it's really all about the people. If it's okay, I'd like to share a couple of the quotes that we've gotten from our members because they are impactful. One is, "I can't believe that I was outside of my house without worry. I feel really good." Another, "I would start to feel upset and then focus on my breathing again. I have really received a lot of benefit and feel like this is going to be a great tool in my toolbox going forward." Those are just a couple of the many stories that members have shared with us. And I think as a health plan, what we've recognized as well is the benefit of sharing those with our employees. Because oftentimes we don't necessarily understand the impact we have on our members. So we take those quotes, we share them with all of our employees, We let them know that we're making a difference in our members' lives, a really tangible difference. And oftentimes then that resonates with our employees. One of our employees, after hearing some of the quotes, sent me an email and said, as someone who doesn't work directly with members, but acts in the background of these programs, I sometimes feel a disconnect. Hearing positive feedback from our members reconnects me to the work that we do. This is helping to kick my weekend off with a great mindset. So it's not only the benefit to the members, but it's also a benefit to our own employees.
Lastly, what advice would you give other health plans who may be considering Freespira but are wondering if it is worth trying?
As other health plans are considering Freespira, the recommendation I would give initially is get your clinical team and your medical directors involved. They're going to be the ones who ultimately endorse this, who look at the clinical studies and the trials that Freespira has done, and they're going to be the ones getting behind this to promote this with members and with providers. We get approached by vendors with solutions all the time for a multitude of conditions and treatment. And if those clinical studies aren't there like they are with Freespira, we really take a pass on it. So that was kind of the stamp of approval that we needed, was the clinical side. Second advice that I would give is look at your data. Look at your underlying members who've been diagnosed with panic disorders or PTSD. Look at those who may have the conditions based on their utilization patterns, and determine what the benefit could be for you as a health plan. How many members could be impacted by this treatment? I think you also want to look back at their utilization patterns. This is not a one-time condition. This is long-term. So that the costs are likely long-term in nature as well. And finally, I guess the recommendation I would give is give it a try. The way we have it structured with Freespira, we, for members who utilize the treatment, we pay for it. Members who aren't interested and aren't willing to engage in it, there's no cost to us. So there's really no downside. This is a win-win. As members utilize the treatment, we will experience that rate of return, and you will experience a rate of return beyond the underlying cost of the treatment.
Thank you, Mark, for sharing Children's Community Health Plan's experience with Freespira. I'm so happy to hear that it's been a helpful addition to the treatments you offer members with PTSD symptoms or panic attacks. We look forward to hearing more in the future as your members continue with Freespira treatment as part of your overall behavioral health care offerings. Thank you all for watching. We invite you to contact us to learn more.